Good evening. Thank you so much for watching HealthLine on PBS Fort Wayne. I'm your host, Mark Evans. We'll be talking about a topic that I don't believe we've ever talked about on this program. If we have, it's been a long, long time. And it's something that's kind of surfing up, up there at the level, and we're hearing more about it. So that's why we're going to do a show on it this evening. And it's fibromyalgia. And it is quite an interesting disorder or disease, and we're going to find out more about that with our doctor here. And he's been with us before. We talked about long COVID, I believe, the last time you were here.
Yes, sir.
And you are a DO.
Correct.
Doctor of Osteopathic
Medicine.
Oh, okay, very, very good. And it's Dr. Kenan Alibegovic.
Well done, Mark.
Oh, thank you. Because there's a lot of tough words I want to have to talk about and say during this program, so I want to make sure I said that correctly. Great to have you, by the way.
Pleasure to be back.
I found it very interesting when I was doing some research before the show about this particular subject, and a couple of light bulbs went off because I believe I might have had some relatives, and still have a relative around that might be affected by this. But I want to let our viewers know that our phone number's on the screen there. It's 866-969-2720. Please call at any time in the next half an hour. We'll address your concerns. And of course, we won't be stopping down for any commercials because it is public television. We always thank you for your support, by the way. Doctor, let's go ahead and talk about this, fibromyalgia. I did find out that that name for that particular, and it is a disease, is that correct?
Correct. Okay. I consider it a pathology.
What is it?
A pathology, a disease.
Okay. It's Latin and Greek derivatives, of course, as many medical terms are, but at one time this was called fibrositis?
Ooh, good find. That was the original term back in the 1980s.
Is that right? Mm-hmm. But I know it did change back. They were working on changing the name of it back in the mid-'70s, about 1976 or so. It's fibromyalgia. Mm-hmm. And I don't know, what was the reason for them changing the name?
Probably because whenever they try to describe a syndrome or a disease, they try to make it something people can understand. Of course, there's such and such disease, which someone laid their name to claim to fame with that disease process, but other times they try to make it as direct as possible. Something like when people have rib pain, that can be called osteochondritis, or pain of the bone on cartilage border, just to make it a little bit more direct.
Well, what exactly is fibromyalgia?
Very difficult question. So the better way to describe it...
That's why we have you here.
Oh, I try. Thank you. No. The best way to describe it is, or from my point of view, because there's nothing definitive and everyone's still trying to think about it in different ways, is I consider it a disease of pain processing, or how your body and brain, from the reception of the pain signal, interpret the pain. The way I describe it is, how can you ever be sure the colors you look at are the exact colors that someone else looks at?
Okay.
In that way. And then, people talk about like pain tolerance and something like that. Well, we truly don't know how people interpret pain. They can tell it to us, but we still can't truly understand like what degree it is. Another good example I give to people is when it comes to heartburn. Everyone knows what heartburn is. It feels like a burning sensation, right? Except when it feels like a stabbing sensation in your stomach, which some people feel like that. And other people almost feel like there's something stuck in their throat and doesn't go away. And it's all about just how that person's nerves interpret that signal. So we already have different examples of how this is, and fibromyalgia, that is how I apply it the same way. It's when people interpret pain a certain way, it comes out different than the general population.
I see. And I broke the word down. I took a little Latin in high school. At one time I was thinking about being a doctor, but obviously that didn't work out. I guess I wasn't smart enough. But anyway, Latin and Greek roots, the fibro is talking about the fibrous tissue. Mm-hmm. And then, of course, the Greek myo for muscle, and then the algia for pain. Mm-hmm. So I see how they put those words together and made this word for this disease. So how many Americans are affected by this?
Roughly 2 to 3%, according to some statistics, and then 2 to 4% in America, and then if you extrapolate it to the general world, anywhere between 2 to 3% of the total population.
Wow. And on that, about 2 to 3% of the population, which is approximately 4 million of adults, living, and who does it affect most? Is it women or men or both?
Women predominantly. We don't know the reason why, and personally, in my practice, I've seen it affect women almost 10 times more.
Wow.
Not the actual statistic, just my personal anecdote.
Yeah, and I'm sure they're trying to figure that out why. I wonder if that has something to do with maybe, as we talked about in the green room before the show, an estrogen situation, because that affects other diseases as well.
Another thing it could be is just the social places of certain women in society and how sometimes they have to deal with a lot more of the stressors that others may have. You know, I'm not saying guys have it easy when they are working all day, but women might have multiple things affecting them at once, and that's what can potentially cause fibromyalgia.
Wow, and do we know exactly what causes it?
No, not directly. Usually, without going into a huge tirade, from what we know about pain reception, there's few long words I'm going to try to describe. There's what's known as nociception, which is the interpretation of standard pain. Like you have pain receptors all over your body. When it hits it, that's where pain comes from. Then we have what's known as neuropathic pain. That is pain that comes directly from the nerves themselves. So think like diabetes, when something breaks down the nerve conduction. Then we have the one that was applied specifically for fibromyalgia. It's called nociplastic pain, or pain that is moldable. And that's where this theory of it is how it's interpreted, or what your brain has it here, it can be molded. I mean, they say our brain is plastic. The more memories you have, the more like connections it makes. Pain can be applied similarly.
That's fascinating.
So in that way, I treat a bunch of patients who, I'll say it like this. With the examples I give are, let's say someone has untreated generalized anxiety disorder. That can come out different ways in people. Some people can have worse heartburn from it because we have our fight or flight system and we have our rest and digest. If you're constantly in fight or flight, these are supposed to be in balance, but if you're constantly in one area, it disrupts everything else. People can get back pain, people can get shoulder pain, people can get heartburn, stomach issues. All of that is because your mind is so taken away with the stress that you're dealing with that it tries to displace it. It's similarly like, let's say you prick one finger and then bash your other finger with a hammer. You don't notice the prick finger anymore because this is taking over. That's my theory on why the body does some of the things it does, and fibromyalgia fits in that spectrum for me.
Okay, and so we don't know exactly what causes it,
Correct.
but are there any specific risk factors? I mean, you talked about stress here. What else?
So there's a lot of conditions associated with it, and because we talked about this last year, they have shown that certain severe viral illnesses can cause it in the same way that people, one of the predictions why people can get something like Guillain-Barré syndrome after the flu, which is the body kind of starts to attack its own nerves in the legs, they think the same thing might happen after a severe viral infection, that it can just take away something from the way your brain can process things, similar to long COVID.
Oh, okay. That's interesting that there is similarities there. Can it be handed down genetically?
From what? I always like to use two distinctions. I always like to say there's something that's genetic and there's something that's familial, and there's a big difference between that. Genetic is directly in your genes, and familial is a pattern that you notice in a family that is clearly related to the family itself or the situation that they're in, but it's not essentially genetically driven.
Okay.
So in the same way, they can't, just because they have it, their children aren't going to get it, but if their children are in the same scenario or stay around them, the same stressors or things that can cause their fibromyalgia could potentially cause it to them.
Wow. Okay, the more we talk about this, the more interesting it becomes. So
Very theoretical, yeah.
Yeah, exactly. So, how is it diagnosed? Of course, you want to talk about the symptoms first. Let's do that. Let's talk about the symptoms first, and then we'll talk about diagnosis.
Oh, and sorry, I realized I skipped over one of your questions, so I'll bleed it together. Other associated conditions that can come with it are different psychiatric conditions. So we don't say it causes them, but we say they're comorbid with them. So things like generalized anxiety, major depressive disorder, chronic fatigue syndrome, and then you can go into a whole bunch of other bodily symptoms like people who have irritable bowel syndrome, interstitial cystitis, which is a type of burning pain in the bladder that doesn't have anything people can find, migraines. I could list things in every part of the body that people can experience that don't always have a definitive diagnosis or way to take a biopsy to give it, and it can fit along the same spectrum as fibromyalgia, either predispose someone to it or the fibromyalgia can cause them to develop it as well.
And there are other things too. I mean, we have chronic fatigue, we have chronic fatigue syndrome to be exact, and then orthostatic hypotension?
Correct.
What's
so
that?
It is, everyone has that. It's the sensation when you stand up too quickly and you get dizzy.
Oh, okay.
And so some people are predisposed to that to a pathological degree where this is not going away within a few seconds. I'm going to fall over such as that.
Wow. And of course, the interstitial cystitis. Again,
that is just, the oversimplification is it is a burning sensation of someone's bladder, but you cannot find anything distinctive or what we call organic to cause it. No UTI, no tumor in the bladder, no chronic inflammatory disease like a rheumatoid arthritis or a lupus. There's just something about it that causes them to be uncomfortable when they urinate. And in the same way that I've seen it with my fibromyalgia patients, those patients tend to carry a lot of like mood disorders, stress.
Wow, and because of the other issues that it's causing, is that correct?
Correct. And then specifically related to the symptoms, the original way to diagnose it was they would use a set of 22 tender points that were across the body. So they would say it'd be like here, 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 different tendinous attachments, where they'd say if you meet like 16 out of these 22, you have fibromyalgia. You can still use that, but it's a little bit outdated because now they see that the spectrum kind of can go differently for everybody. So they say that you at least have to have some widespread muscular pain and tender points along those muscles that can't be described by some organic cause. Usually some degree of either inflammation of those tendons. It can affect joints, but the joint specifically can't involve any inflammation or swelling. So essentially when we rule it out to find another disorder. Those are the pain, that's the pain side. Typically it involves some degree of any one of those associated conditions, decreased energy, and then another common one is sleep. That is a lot of the things that fibromyalgia can carry.
We mentioned earlier that it does affect adults, but do children come down with this?
Yes.
Oh. Because of particular stressors?
That is my prediction, because I say we're all equal in the eyes of our life stressors.
Yeah, okay. So it does affect some children, but mostly it's an adult thing, and mainly women.
Predominantly I've seen female adults, but yes, it could affect anybody.
Wow, okay. So I would imagine you'd have a field day trying to diagnose this and make sure you've got the right prognosis and so forth. So it's not a straightforward process.
Unfortunately not.
A bunch of other things that have to go into this. What other kind of testing would be involved to narrow this down?
The generic answer everyone tells you is a good history. Once you start to figure out everything happening in that person's life, you can kind of get a good idea if something is more organic or something that could be coming from their body directly, or if it's more psychosomatic, which is coming from the mind and being displaced on the body. Other ways to test it are, besides taking a good history, you can physically do the exam on the points that hurt, and if you don't find anything different besides the tenderness, that can kind of clue you in. Ruling out the other conditions that I just told you about is another thing you have to keep in mind, because can a lot of these mimic fibromyalgia and look just like it? Oh yeah. It's actually been shown that a lot of patients with true rheumatoid arthritis, fully diagnosed, have inflammatory markers, or seeing a rheumatologist, can have fibromyalgia pain on top of their rheumatoid arthritis pain, and the rheumatologist can actually delineate that and say, here's the thing I can treat you, and the rest of this you should go see your primary care doctor for more optimized treatment.
I see. Very good. If you're just joining us here on HealthLine here at PBS Fort Wayne, we're talking about fibromyalgia, and Dr. Kenan Alibegovic is with us tonight, and a very interesting topic. Give us a call if you have any questions regarding yourself, or maybe someone you love, or one of your friends that might need some help as well. So the phone number is on your screen. Excuse me. So how do you cure fibromyalgia?
In the same way with patients who have a chronic pain syndrome, it's not really about curing, it's about getting your life as optimal as possible. So we always talk about something called the ADLs, the activities of daily living. If you are able to do your activities of daily living without too much harm or weighing down on your mind, then we consider that well controlled. Again, big difference between curing and controlling. And the fibromyalgia is not something that we found out for a true cure. So in that way, the first thing I always talk about with my patients is to have a good goal in mind. So for instance, if they tell me their muscle pain's always an 8 out of 10, I say, let's shoot for a 5 out of 10.
Okay, well, yeah, let's shoot for something. Anyway. So is that rather distressful for some patients to find out that you will probably have this the rest of your life, but we're going to have to control it?
Incredibly. Initially, it's always the first discussion where people really take the severity of it. I can say consistently for the people that I've treated that when it does get better, they realize, oh, there's something I can do. Because it's always that initial desperation of this will not get better, this will only continue getting worse, and that thought process by itself will make the symptoms worse.
And you have to try various things, is that correct?
And it's usually the first time you have some sort of breakthrough, that's when they say, now I have the enthusiasm to keep going, and that by itself will help the symptoms.
Now, is there a chance that that aha moment won't last forever? I mean, is it something that, you've discovered that it helps now, but is that going to possibly wear off or change down the road?
Potentially, depending on, again, things that happen in your life. You could develop other diseases, other disorders. The stressors can change. You might lose someone in your family. A lot of things can hit you hard like that, and they can work the same way.
How bad is this pain? I mean, is this pain to the point where people, just break down and cry? It's so painful. Or is it just an annoying, agonizing pain that just won't go away when you're describing the sense of this pain?
I've had patients tell me that it is this constant pressure sensation across all of their body, that they don't feel like it ever goes away. Some patients have told me that it feels like the physical representation of what their depression feels like, whereas they say they always get weighed down mentally. Oh, and then the fibromyalgia physically keeps me locked in place and not wanting to move my joints because it hurts.
Wow.
So some people can describe it as incredible 10 out of 10 pain. Most of the time they say it's this constant pain, somewhere between a 5 or a 7 for the patients I see personally, and they say it causes me a bother and I would like to do something about it because, again, their activities of daily living are not good for them.
There's a constant pain. You might have touched on this earlier, and I apologize if I'm being repetitive. But is it a constant pain, or is it pain that goes away, comes and goes, or is it a little bit of both?
Both.
Oh.
It can be both. It's different for everybody.
Okay. So it's a very individualized disease for people. Wow. Okay. I want to get into the treatments, but before we get into that, are we looking at a lot of research that's been going on? Are we trying to tackle this and trying to get to the bottom of it? Aggressively?
I would not say aggressively. They've tried several times in the past, and when someone gets in the past when people got worked up for fibromyalgia, they would do things like muscle biopsies, nerve biopsies. They'd rule out every potential inflammatory condition, and they've tried so many different ways to figure out something, but it just hasn't given us any significant evidence. In the same way that, like we discussed with the long COVID, there's only theories and ideas, and nothing concrete has happened even after, God knows, almost 4 years of concrete evidence that the country has put in to try and figure it out.
Yeah, and we don't know the half of it yet, I have a feeling. Can this be deadly? Is this something that can affect your physiology as far as your health, long-term health? Can it kill you? I'm just going to be blunt about it.
In the same way that someone who has significant major depressive disorder commits suicide, that is what fibromyalgia could lead if it's bad enough and untreated. It just continues to wear down on the patient, and it may lead them to different places in life that they wouldn't want to be, and that can lead to the end of their life.
Wow. Well, hopefully we don't get to that bridge for anybody. But let's talk about the treatments. What's involved there?
So it's more targeted at the symptoms, and everyone can have symptoms differently. So like I said, there's usually some amount of decreased energy, sleep, pain. Those are the 3 I usually hear in patients, and each of them can be targeted differently. The one that people may hear about the most is something like a antidepressant, anti-anxiety medication. So commonly for the energy component, again, it's not necessarily that everyone with fibromyalgia has true generalized anxiety disorder or major depressive disorder, but they have something in their life that's affecting them that can drop down that energy level. They say to go ahead and try something like an SNRI, so that's like a Cymbalta, an Effexor, a Pristiq, something like that. And I've had good success in these patients, people who have true fibromyalgia.
Now, and I know it's a physical thing. Oh, we have a call coming in. Excuse me, I will get back to that question in just a moment. We have a call coming in, and it's by Drew, and preferring to stay offline. He's asking, how does the diet affect fibromyalgia? And are there any lifestyle changes you can recommend? Oh, some good questions.
That's a great question, because it goes into some of the treatment recommendations I have. There's no specific diet for fibromyalgia, but there have been a few small studies that have shown the low inflammatory diets have been beneficial for it. So ones that reduce the amount of omega-6 fatty acids that you use, so like switching over from vegetable oil, canola oil, fats, margarine, to stuff like avocado oil, olive oil. Actually, canola oil has the best of the regular vegetable oils, but stuff like that, eating healthy fish, getting in good fats, that's a way to reduce inflammation, and there have been some studies that suggest that can help. That's one good one. You can also do a vegan diet. I mean, there's now been more than enough studies to show that that can be beneficial for multiple health conditions. I don't know about a specific one for fibromyalgia, but I would believe that would be incredibly beneficial. And then going back to one of the associated syndromes, irritable bowel syndrome, that one, there's actually a diet, if a lot of people don't know out there, called low FODMAP. FODMAP, I'm not going to embarrass myself, stands for a certain type of sugar structures. And my theory is that everyone has their own unique set of bacteria in their stomach that processes foods differently.
The gut bacteria?
Correct. And so what a low FODMAP diet is it takes away the change sugars that bacteria are more predisposed to cause, like bubbles. Like whenever some of my patients with fibromyalgia talk about being bloated all the time and it's uncomfortable. So I recommend that they look into a low FODMAP diet. What is a low FODMAP diet? You will have to look it up online because it gives you like 50 different food options on both the bad and good side, but those are a couple different ways to look at it. Either a low inflammatory diet, vegan diet, or a low FODMAP diet.
Okay. Very good. So nutrition can help. You've seen
potentially significantly. I've had some patients that just change their diet and it's already 50% better.
Wow. What about obesity? Does this have anything to do with it?
In the same way that patients who one of the risk factors for developing osteoarthritis is weight, because it's physically bearing down on your joints more than our ancestors evolved to have the joints be able to handle things. The weight itself could potentially make joint pain and muscle pain worse.
All right.
They also say that with increasing weight, it increases generalized body inflammation, and so that can predispose people to pain.
So we've talked about some of the medications. What about psychiatry? Psychiatry, or going to a psychologist. Would that be able to help you in any way if you've really got the stressor situation going on here?
Oh yeah, certainly. Because I always offer it to my patients. Some people don't have the time for going to see like a behavioral health therapist, seeing a psychologist, seeing a psychiatrist. But if you feel like the behavior symptoms or the energy symptoms aren't being fully optimized, it's always reasonable to send out a referral. Similarly with the other symptoms that I didn't describe, some of the treatments, like if someone has sleep, there's an atypical depression medicine you can use called amitriptyline. If that one doesn't work, you can always send them to a sleep specialist to be evaluated for potentially they also have concurrent sleep apnea, which would be a part of their workup to see if they're not physically getting enough oxygen to their brain, and that's why everything's hurting and why they're so tired all the time.
Wow. Well, and they're tired too because they're trying to, I guess, overcompensate
And fight it.
and fight the pain. Yeah, that will wear you out.
Oh yes. And then the other one that is I apologize. It wasn't amitriptyline for sleep. It was actually gabapentin or Lyrica, which are nerve agents that can sedate people, and it just kind of works the same way that we think it's a nerve problem. The amitriptyline is good for the pain component, specifically if you just have all this generalized pain. It's a type of medication that can help people with like chronic neck pain, chronic back pain, and it's always something reasonable to try.
Also, I noticed in my reading before that if the treatments that you did not, that you actually mentioned don't work, rheumatology can help as well. And I wonder if that could be a significant help.
You have to have a high suspicion for an inflammatory condition at that time, because there are a lot of good rheumatologists out there that can get a lot of patients that have fibromyalgia, and it is not a disease that I would say, it's not that it's not worth their specialty to treat, but that a lot of family medicine doctors could apply the techniques we learned to treat it, and a lot of the times the specialist should be working on the specialized cases that need more help. Obviously, if you think they truly have something like lupus, rheumatoid arthritis, there's a basic workup a lot of family medicine doctors can do, and then if there's further concern, you go get a second opinion. I've done that for a couple patients that I thought may have something unique, like what's known as a seronegative rheumatoid arthritis, which is rheumatoid without any inflammatory markers, and I've known several people in my medical school who've had that, so that's another conflicting thing, and why it makes this whole picture conflicting.
Well, and yeah, it sounds like they have a lot more research to do on this, but
Yes,
it
sir.
also sounds like from what you're telling me through your experience that you've kind of got a handle on it, and there are various options, and you can go various directions to try to figure out what is causing this.
Correct. The big thing I like to tell people is there are options.
Okay, and that's very important. So I guess my final question here is, when do you, how do I phrase it? When is it time to seek help and who should you consult first? When do you know? What is your body telling you to say, hey, you probably need to go see a doctor?
It is all based on the individual's determination for themselves. I just saw a patient today who thought that they had this raging heartburn that nothing else could help out with, and they've tried a couple different medications and some are helpful, and ultimately I said, I think you're stressed out. We're going to try an anti-anxiety medication. They're like, no, I think I'm fine. And that's true. People can have major depressive disorder, generalized anxiety disorder, and it's well compensated, which is they can deal with it, they can take the symptoms, they can ground them, and it's okay. But if the exposure to the stress gets worse, or if they lose the ability to compensate for it, then that is when it becomes a problem. So most of the time when I would tell someone to come get help is if you start to feel your sleep just getting worse and you just don't know why. If you feel your energy levels are dropping down and you don't know why, or if there's this basic pain in your body that's something like stretching, Tylenol, ibuprofen, the usual stuff you can do isn't working, those are some of the things to say, maybe I should go talk to a doctor to see if it's something that needs a workup.
Excellent advice. Doctor, thank you so much again for being here tonight. Very interesting
Always my
subject,
pleasure.
and when we find out more about it, we'll have you back.
Gladly.
We'll recap everyone. We thank you for watching and for your phone calls, and much appreciated. And of course, you can watch this episode as well as other HealthLine episodes on YouTube. Until next time, good night and good health.
PBS Fort Wayne was made possible in part by
Momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.